Good afternoon. My name is Sarah Howard, and I'm a graduate student here in the Diedrich College of Communication. In May, I graduated with my undergraduate degree in journalism from the Diedrich College of Communication. Last semester, I worked on Lillian's Poor Health Project, which we learned about this morning. When I started working with Lillian Thomas on this project, my first assignment was kind of to get myself oriented to the history of healthcare in the United States and kind of the evolution that it's gone through. The task was fairly daunting, but Lillian had a great example to tell me about. She told me about a group of Christians who in 1863 bought a property just up Kilbourne Avenue from here. They turned it into Milwaukee Hospital, which Lutheran deaconesses staffed, and it was a charity hospital. The facility merged with others like so many do, and eventually was bought by Aurora Healthcare and charged patients for services. When the organization began to struggle financially, it was left vacant, and in 2000, Aurora transferred the property to a new nonprofit organization called City on a Hill. Lillian loved this full circle story, and it doesn't reflect many that she learned about in her time researching and studying healthcare. Most of the reason for this was the help of Diane De La Santos. When she was the Vice President of Public Affairs over at Aurora, she heard about a community group that was trying to have a community event that would serve the public and have free health screenings. They needed a place to do it, and she thought the parking lot near the old hospital would be a great site for it. They held the event, and thousands of people showed up. She recognized the need for help in this community, and after talking with the nonprofit organization, City on a Hill was formed. She came on as one of the board members, and a couple years later, she became its executive director. She wanted a role that would give her life significance after working in corporate healthcare for more than 20 years. She now runs City on a Hill with less than $1 million budget and 14 full-time employees. She is known at City on a Hill for her warm greetings and treating every patient and every person who walks through the door with a warm welcome. Let's do the same for her now. Everyone, Diane De La Santos.
Thank you so much, Sarah. Good afternoon. It is great to be here with you, and I couldn't help but thinking as I listened to the introduction and to Lily earlier talk about full circles, how I myself have sort of come full circle in many ways into the role I'm in today. My healthcare, at least the healthcare part of my career, began in the early 80s. In 83, I was hired as the first marketing professional for Good Samaritan Hospital, the hospital where City on a Hill is located today. And, you know, it was a time in which people were perhaps in new ways trying to grapple with the issue of healthcare and access for people and the cost of healthcare. So in 83 was the era of DRGs and prospective payment and Medicaid patients being channeled into HMOs with the dream and the promise and the hope that we would actually be improving and maintaining health, not just providing healthcare services. And, you know, we continue today to try to accomplish that purpose. And my own entry into this nonprofit organization, City on a Hill, began as I was focused not specifically on the physical health of the city, but just on the devastation in the city in Milwaukee. As I literally would read the Milwaukee Journal-Sentinel in one hand and because of my faith perspective, scriptures in the other, and try to figure out what my faith would call me to do as a reaction to what I was seeing in the city. You may remember that was a time in the city where there was a lot of violence, house fires that were killing children, just very difficult times. And so I moved into this role. And one of the things that someone said to me early on that has become sort of a mantra for me, perhaps, is that you can't solve a problem you don't understand, and you can't understand a problem from a distance. And so I've learned so much in my 10 years at City on a Hill. I've learned so much about generational poverty and race and how those things in our society affect the health of our population. And I've come full circle. There was a period in my life when I was struggling in poverty as a single mom and had a Medicaid card in my hand. And then, of course, I became a fairly wealthy executive in the healthcare system, and now I'm sort of right back full circle in that community. A few years after I became the director of City on a Hill, I just felt called to get even closer because, frankly, you know, as I was trying, you know, I process things through my faith. So as I'm trying to listen to the Lord about what we can do to make a difference there, I just felt like I was having a conversation with him that says, you know, when I came to rescue you, did I commute from a distance? I was living in a beautiful condo in Greenfield, but working at 23rd and Kilbourne. And the answer, of course, was no, and my response to that was to sell my condo in Greenfield and move into the hospital building. So that's what I did, and lived there until last year. And as you get closer to a problem, you can begin to understand it so much better than you can from a distance. You really can't from a distance. And so that occurred in 2006, and 7 years later, I made yet another step closer to this problem that has opened my eyes to sort of another layer underneath even the social determinants of health. And I want to share that with you before I'm finished here in these few minutes. But let me just back up a little bit. So, you know, we're in healthcare. We're trying to manage the cost of healthcare. Then in the 90s, there was this emphasis on community health improvements and assessments and population health, and seeing what we could do with prevention to try to redirect some of the funds so that we were not just providing high-tech, costly care for people in acute situations, but we were actually preventing some of the disease, and always trying to address the disparities that we see between rich and poor, between black and white, between inner cities and suburbs, and in all the statistics about healthcare. And of course, today now the one of the approaches that we're taking is through the Affordable Care Act. And as of a couple days ago, walking someone through a process of obtaining care, I have a new perspective on that as well. But let me just back up and talk to you about this health disparity. I have a small display out there that has this a handout that will include more on what I'm going to share with you just briefly. But the title of an article from Health Affairs some years back is "What if we were equal?" And it's a comparison of the black-white mortality gap in 1960 and in 2000. Rather, in 1960 and 2000. And of course, the greatest disparity in our nation in healthcare is along income lines, and specifically because race and income run hand in hand in America, along racial lines, and particularly among Black Americans, not to discount the disparities in the Hispanic community, and the Native American community, and so many other groups that have historically dealt with poverty. And one of the reasons, of course, is that it's not situational poverty. I lost a job and so I don't have access to health care today. It's generational poverty, which is a whole different thing, which I'll talk a little bit more about. At any rate, this article talks about the health disparity, and I'd just like to read a sentence or two for you of this article. It says, "The United States has made progress in decreasing the black-white gap in civil rights, in housing, education, and income since 1960, but health inequalities persist." And so they examined the trends looking at standardized mortality ratios, SMRs, which basically are if we held everything constant, even income, even education, even health behaviors, if we held everything constant, what would we see? And what they found is that the SMR changed very little between 1960 and 2000, and it actually worsened for infants and for African American men age 35 and older. And so using this data then from 2002, they determined the number of what they call excess deaths in America, so that deaths based on all those other factors should not be occurring, right? And the numbers vary. The numbers vary slightly, but this article found that the excess deaths were an estimated 83,570 deaths in America. That's the equivalent of a jetliner crashing every day, 365 days, 40 years in America. So it's a huge problem. You know, and if it were occurring in those stark terms, surely we would be mobilized to operate in a different way to solve this problem, rather than just looking at as something that we can incrementally address in small ways. And especially when you think that in 1960 there was no Medicare or Medicaid. And yet 40 years later, the gap hasn't decreased. I mean, that's a startling conclusion. And they go on to detail this for you. You can read it if you're interested. They ask the question, what systems change could we undertake as a nation to assure that these mortality ratios do not remain flat over the next 4 decades? And they reach a conclusion that might seem very sobering, and it is this: the interrelatedness of personal health behavior, social determinants, neighborhood ecology, provider bias, structural inequalities, and institutionalized racism suggests that eliminating barriers will require large-scale, multidimensional, community participatory, meaning get John involved, right? Community participatory interventions focused explicitly on health disparities for specific population groups, as well as on broader dimensions of social equality and economic justice. Even so, disparities-specific interventions could eliminate thousands of premature deaths in the United States every year. There really is something that we can do about it. And one of the things that I've learned about sort of theoretically and now very personally is the connection between poverty and poor health outcomes, and the connection between race and poor health outcomes in a country that, though we have fought slavery and racism for decades, still is very racialized society. And it is this, that when we feel threatened or we feel like we don't have control over significant measures or aspects of our lives, it puts stress on us. And the adrenal gland kicks in, it raises your blood pressure, which is good if you are running out of a fire or lifting a heavy object off of someone who's in desperate need, right? That helps. But to have your adrenaline sort of supercharged all your life, persistently, just puts tremendous stress on your organs. And so the other article that you'll find there talks about this, and it says when the stress response turns on for months or years, our body produces too much cortisol, and this can do the following things to our bodies: inhibit memory, cause parts of the brain to shrink, inhibit the body's ability to handle glucose, which increases the risk of diabetes and heart disease, which you know, of course, have high incidence in communities of poverty. It all adds up to an increase in disease and accelerated aging. And the chronic damage just affects people's health over time. So some of the contributors to this stress I'll just outline very briefly, and then I'd like to go on and talk about some of my own experience and the learning that has occurred for me in the process. First of all, there's worry about food security. People in our city are worried, are they going to have enough to eat today? All right? So in third world countries, you know, the issue is not enough food. In our country, for some people, some children in Milwaukee go to sleep hungry. It is enough food, but it is more so sometimes the quality of food in food deserts like where City on a Hill is located. You can go to a fast food restaurant or you can go to a corner store, none of which are going to give you very good nutrition. The second one is lack of control in life and job situations. You heard a little bit of that in John's life, right? You're in a job, if you can find one, where you have less control, less job security, less say in the workplace, less supervisor support, fewer or no benefits, more hazardous conditions, hence the workplace injury that John suffered. You've got more debt, you've got more worries about your child's safety, you've got more trouble balancing life and work, and so you lose jobs over and over again when the crises in your life hinder your ability to get to work, and you don't have healthy access to methods to relieve your stress. You don't have a gym membership, right? The third is this issue of constant vigilance and being on guard, all right? If you're black in America, you are still on guard in many circumstances of your life, much of your life. And if you have enough income, it can shield you a little bit from that, but not completely. And so some of the studies that I've learned the most from are from the California Newsreel Project. They've done studies on health inequalities, and they've looked at this. And I still remember the story of a black female professor who struggled with the loss of a baby. And the infant mortality resulted despite the fact that she had beautiful access to care and education and didn't smoke and ate right and all the rest. But the chronic stress on your body affects your organs and can contribute to health problems even when you climb out of the poverty that is around you. And so the racism still present in our society causes the members of our community who are part of ethnic minority groups, and particularly African Americans in our country, to have this sort of hypervigilance. even if they are living in situations where they don't often face discrimination. They've seen enough, they've experienced enough, they've heard the stories of enough, they see it all around them every day, and they never know at what point they may be a victim of that. That puts stress on your body. And so the elevated stress levels literally chemically interfere with the development of neural pathways, and they affect children especially, their developmental processes and their capacity to learn, to say nothing of the fact that children are growing up in violent environments where the assaults on their system are present, even apart from their own experience of mistreatment. And so the last one then is racial discrimination, and it just contributes to chronic stress levels that worsen the health outcomes of people of color, who are often the people in poverty. And you know, in a city like Milwaukee, which is said to be the most segregated city in America, I believe we can't talk about this issue without talking about race, or we're missing a key factor. So maybe just to segue, you know, we experience life through the lens or the filters that have been created as a result of our living life, right? And they are how we interpret the events around us, and they shape our perceptions of people and events. When I was with Aurora Healthcare, I did public affairs for so many years, and so I worked with physicians who were on the cutting edge of things. And I remember working with Dr. Doros, a cardiologist who was doing a conference because he was doing cutting edge things at St. Luke's in cardiology. And the theme of his conference one year was, and he was trying to help the doctors look inside, you know, the anatomy and the functionality of our circulatory system and so forth, and to see what he sees. And the theme of his conference was, we only see what we know. We only recognize what we already understand, right? And so if we're coming at this from the outside, well, first of all, if we're living in an environment where we have seen poverty and trauma and discrimination and hopelessness, that's the lens through which we look at life, right? And that affects our health. Those of us then coming from the outside who don't necessarily see all of those things, nor do we often see the giftedness of the people that we're serving. You know, we can see it now in John because he's at a different place. But at the point that people are the most broken and struggling, we don't see it. But it's there. And we don't often see what's underlying the health issues that we're looking at, you know? I mean, the medical professionals can see the disease that they're treating, right? If they're effective in their diagnosis, they can see the disease that they're treating, but truly they're treating the symptoms, you know? I mean, you're treating the symptoms, the physical symptoms of what's happened in the person's life, right? And that what has happened in their life may be the product of social determinants, and so as Lily said, we may need to write prescriptions for food, or fix the water supply, or deal with the mold in the apartments, or the lead-based paint, or whatever it is. But in addition to social determinants, there is also this whole sort of emotional damage, the cognitive impairments that occur, the spiritual sort of purposelessness that you heard in John. You know, I didn't feel like I had a purpose, a reason. Part of the reason he's joyful now is he's beginning to see that the pain that he's gone through can be used to help someone else. That gives a person tremendous sense of purpose and meaning for what otherwise is meaningless and traumatic and damaging, and there's nothing good in it, you know? When you can find some good in that and put it to use, it changes your perspective. The lens that you look at life through changes a bit. And if people are going to implement the recommendations of their doctors, right, to eat better, to exercise, all these things that they're told to do, if they have no hope for a future and their orientation is strictly in the present, and they're dealing with the pain. I appreciated in Lily's presentation, you know, the people's misery is the mother of the disease. I mean, if they're in so much emotional and pain and sort of cognitive challenge processing what's happening in their lives, there is no motivation or strength for changing behaviors in order to improve your health for the future. You don't know whether you'll have a future, and you have no energy. You're just trying to cope with the pain that you're in today. And so I think that you've got the health symptoms. Before that, you've probably got these social determinants that kind of precede and follow everything else. You've got the behaviors that we see that we're trying to change in people, whether it's poor nutrition or drug addiction or whatever else it may be. But before that, you've got the coping mechanisms, because the behaviors that people are engaging in, they make sense. We think they're foolish and they're damaging and they're harmful, but they make sense when you're in pain and you're trying to alleviate pain right now and no one is helping you see a path out of that pain into the future. So you're going to use drugs. You're going to sit in front of the television and try to take your mind off of your problems rather than exercising. You're coping. And before that coping mechanism is the pain. And for us at City on a Hill, we're trying to address this issue in two ways. One is to make sure that as we're meeting the physical health care needs of people like John, we serve about 300 people a month, and perhaps 25 to 30 of them will see a doctor during that month. And the rest of them, really all 300 of them, will take advantage of the rest of what we try to provide for people so that we can give them a safe place and an experience of life that maybe changes that lens a little bit for them, all right? Is a fishing analogy for you. If you're fishing in a stream and there just are no fish in the thing because it's moving too fast, the fish can't really live there because they have no place to rest. Any fishermen in the room? If you put big boulders in that river, you will begin to see it populated with fish again, because everywhere the boulder is, behind that boulder, where the stream is moving, there's a little eddy that's created, a little quiet space, right, where people can rest a little bit. Fish, rather, can rest a little bit. In my experience at City on a Hill, it's a little peaceful place. It's a little boulder in that neighborhood. And people can come in and just rest a little bit. So often people will tell me, I love this place. There's no fussing and fighting in here. It's peaceful. Or I feel like it's family here. Or I know people love me here. And if you can begin to, one woman who everyone would have written off as hopeless. She came to that first event that we had on the parking lot. I wasn't really going to tell her story, but just briefly. She came to that event. She was a crack-addicted, homeless for 20 years prostitute. And she came to that event because she heard the music that we had along with the health screenings and all the rest of it, and she knew we were giving food away. And so she came. And years later, not even having really known Rose, I met her at one of our health outreaches, the same thing that John comes to. And there was a woman who was with a volunteer group from a church, a Central City church. She's African American, most of the people from her church were. And she came up to me and she said, my friends told me I should tell you my story. And I said, okay. And people are always telling me, how they got connected with City on a Hill, so I thought she was going to tell me that. She said, my first connection with you was on the parking lot at that outreach event that you had. And I thought, oh, you've been volunteering here a long time. She said, oh, no. She said, and she told me her story. She said, I was living in a crack house, or staying in a crack house, because people don't really live anywhere. Staying in a crack house across the street. I was strung out on drugs. I hadn't slept in 5 days, and I came to this event. She said, I didn't really want anybody to talk to me. I just wanted some food and some peace. And so I came over there, but she said the volunteers looked at me with such love in their eyes that it planted a seed of hope in my heart that my life could change. And so she, unbeknownst to me, kept coming back to our health outreach month after month after month. I said, well, Rose, I don't remember you. She said, well, first of all, you wouldn't have recognized me because I was skinny as a rail and I was strung out on crack. You wouldn't have recognized me. And second of all, she said, I was not trying to be seen by you. And she would sleep, we have a little chapel, she would sleep in the pews of the chapel and eat and try to panhandle our volunteers, and then go back out there again. But it was a little eddy. It was a little place behind a boulder. So years and years and years then later, she, in a jail cell, finally sort of came to the end of this and got sick and tired of being sick and tired, had an experience of spiritually sort of committing her life to the turnaround that then was accomplished. And now she's involved as a minister in our organization, or a volunteer in our organization, rather, and has a Facebook sort of ministry that she does with 8 other women who were drug-addicted prostitutes on that parking lot in the year 2000. So, and for Rose, not only is she seeing transformation in her own life, but all the childhood pain that drove her to the streets, that led her that 20 years of homelessness, now is redeemed, if you will. It's turning into something that can be good as she helps others. And so, as a little sideline. But at any rate, we only see what we know, and we're only going to be able to see things if we get a little closer to them. And so one of the things that City on a Hill does is we make sure that we are holistic in our approach. Sometimes I get criticized, even from the people who are supporting us. Even our board members had some dialogue with me the other day about whether the work that we do is not way too complicated and we should just simplify it and do one thing. Mm-hmm. But if you're trying to transform lives, you can't do it in a unidimensional way by fixing one thing, because they're all interconnected. And you can't get health care if you don't have transportation, and you can't do this. It's just, you go back and back and back and back. And if you go back far enough, where you will end up is childhood pain and trauma. I can't tell you the number of times when I'll be talking to someone who's waiting for services at City on a Hill and ask them how they're doing, and they'll be so transparent with me, and I will hear. I still remember a time with a man named Tony. He's struggling with mental illness. And at first, he wouldn't even respond when I spoke to him, but now he's quite conversant with me. But I asked him how he was doing, and he immediately told me of childhood sexual abuse in his life. And so it's pain. It's either specific traumatic events, which there are many when you live in poverty as a child, or it's just the environment where every door closes on you and there's not access to what you need. It hinders a child's development. And it causes people to struggle for their lives. So our answer to it is to be holistic in our response to the adults in our neighborhood, and frankly to spend most of our resources on children and youth. And so most of what we do, there's a brochure out there if you want to pick one up, most of what we do is with children. And we likewise do home visits in those children's homes, and that's the only way we understand the behavior that we see. And that's the only way we're able to bring transformation. But we're a youth-serving organization that very recently has started to get some accolades for the work that we're doing. And people are surprised that we serve so many teenage boys and that they stay with us for 6 or 8 years. And it's because the environment is one of love and protection and a place where they can grow. The other thing that we do, if any of you are interested, and then I'll wrap this up, is that we do training in poverty and justice to try to help those of us who have more and have the ability to solve these problems to become motivated and educated so that we can make a difference. Because what's happening in Milwaukee, of course, is happening across Wisconsin and across our country, and we all can collectively make a difference. So let me just close by this. My understanding of the issues facing us when we look at poverty and health, or poverty and most anything else, but it manifests itself maybe most deeply and obviously in the health of the people. It took sort of a quantum leap, and this will be very personal, but it's the only way I'm able to really understand things better now. It took a quantum leap last year because after being a single woman for many, many years, I married into generational poverty and into a black family that deals with everything that I'm talking about here today. And so I understand in a whole new way the challenge and perhaps some of the solutions. My husband, like you might say of John, is extremely talented, extremely gifted, but grew up in abject poverty in the Robert Taylor Projects in Chicago, basically 16 stories of people in poverty and chaos and violence, and succumbed to that whole sort of life cycle that is so prevalent in urban areas, involving the poverty and the violence and the crime and the addiction and the incarceration and the unemployment, and then the circle goes on, And it's very difficult to get out of that, and we don't understand how difficult it is. And so now as a middle-aged man, he was just diagnosed with post-traumatic stress syndrome. And he's never fought in a war, but he grew up in urban America as a black man in poverty with a teenage mother. And so now I'm helping my husband and my mother-in-law to navigate the healthcare system and to see their lives transformed. I'm sure I've probably gone too long, but let me just close with this. The solution to poverty is not money, and it's really not just programs. It's life-giving relationships. And so unless we have the willingness to invest the time to walk with people through life and through this transformation and the transition from where they are to where they need to be and where we want to see them be, if we're not willing to walk with them or structure our systems and our services so that people have the time to do that, we won't see immeasurable change. But there is victory on the other side of this as people have what they really need, which is advocates and people who love and people who care and people who know the system and can access pieces of it but can walk them through the transitions. My mother-in-law, Teresa, is in the process of being diagnosed, and she has access to care now through Badger Care, through the Affordable Care Act. But nonetheless, if I were not in her life this past month, as medical experts are trying to diagnose what may be a cancer in her, she'd probably still not be where she needs to be in this process because she has access, but she has now maybe 10 doctors that they're sending her to for second opinions and tests and so forth. She can't navigate the system. She doesn't understand it. And so I go to her with her to appointments. We were the other day at the Aurora Women's Pavilion in West Dallas. Excellent, amazing facility, wonderful access to care. And she probably never would have gotten there if I wasn't with her because she was so just incapable. Her literacy is limited. She was a teen mom. She didn't finish school. She doesn't understand the systems, and she's frightened, and she's insecure. And so we go to the x-ray department. She needed a chest x-ray before she can have a procedure. And the woman said to her, do you want to take care of your obligation? You have a copay here. And you could see terror on her face. I said, Teresa, it'll be okay. She said, well, how much is it? I don't have very much money. And people will not go because they think they can't afford it. She says, it's $2. She said, oh, I can do that. I can pay that. And her copays range from 50 cents to $3, but it doesn't matter if she doesn't have an advocate to help her get where she needs to go and some help to do it. She's afraid she'll lose her job if she keeps an appointment. No one says to her, Teresa, when is a good time for you to come for this appointment? They just say, come Tuesday at 3. She's like, oh my goodness, I work Tuesday at 3. I can't do that. I'll have to wait till next month. And so people just need people in their lives, and they need compassion in their lives. And that's what I've learned at City on a Hill. But we can make a difference.